Welcome to episode number 5 of the GBNO show. I'm Dr. Rob Jones. This is my wife, Shannon. GBNO means get better, not older. If you're tuning in for the first time, you don't know who I am Dr. Rob Jones. I'm a chiropractor with over 25 years of experience. I focus my practice on sports injuries, rehab, proper movement, strength, and conditioning, more than just your average chiropractor. I also am Hey Dr. Rob on all the socials, so hopefully you've seen my stuff. Shannon's a dietitian. She specializes in health from the inside out. She's a cellular nutrition and obesity specialist. I am the guy who focuses on health from the outside in. So basically, we're teaming up to help you get better, not older. Now, concurrently, we have about 50 years of experience between us. My passion is helping people move better, because as you age, your body's going to want to slow down, but you can mitigate that by doing more and doing the right type of things. From your side,
I want to help people age in a way that promotes a healthy weight, but also doing that in a way that prevents disease as we age.
For years, because we've been a health team, our friends have always asked us about stuff. Hey, what do you think about this? My daughter's got this, my son has got that. And these are our dinner conversations. We kind of dork out at this because we're passionate about it. We talk about studies that we, read that day, or a clinical situation I had or she had. That's our dinner conversation. So we thought, let's bring it to folks. Let's get you guys informed so you can live better from the outside in and the inside out. So that is what the GBNO show is all about.
Truly our start to really collaborating. We've always wanted to do this, but it's so much of what we do obviously crosses over. So
yeah, plus we had younger kids and we didn't have time. Now our kids are a little older, we have a little bit more time. But the biggest thing is we're both super passionate about preventative situations in life. I want people to move better so they don't have to go to doctors so much when they're older. Same thing with Shannon. She wants them healthier so we don't end up all stooped over in our 70s. We don't have to spend all of our spare time in our golden years going to doctors. That's why we actually even developed the GBNO program, which is a 12-week program that I start you out with the foundation. Again, GBNO being get better, not older. It's a foundational program. Get you moving right in the right places. Stabilize you out in the right places. Once you've done that, we start to build a foundation of strength and conditioning, and including with that is some really great advice on nutrition from Shannon.
That's right. I see in that particular protocol, I have 25 videos that take you from a very basic level, evaluating your metabolic health, all the way through how to live and develop a lifestyle that does it in a way that you're preventing disease as you age.
Okay, so each week we're covering topics. Some are older topics, some are newer topics, some of them are actually trending topics. Well, the topic this week is inflammation. Basically, inflammation is one of the most important things we have to mitigate as we age, simply because it drives almost everything. We have a huge body of research showing how inflammation not only can affect the outside in, which is my area, but again, Shannon's cellular inside out. Really, we know the products we're getting are creating inflammation that we're feeding ourselves. The products we're cleaning our houses with are increasing inflammation. Our movement, if improper, is increasing inflammation. The food we're eating is causing a huge amount of inflammation. That's where Shannon's going to talk about mitigating that, because it's easier than you think. Now, in my world, there are really two types of inflammation we want to be concerned with. There's something that's called a macro trauma, like you roll your ankle, you fall and bruise your knee, or you are playing tennis and you sprain your rotator cuff. That's a macro trauma, something, or like a car wreck, something that happens at once. But most of the time, it's micro trauma that brings people into me. It's mousing and computering too much, keyboarding, you end up with carpal tunnel. That's an accumulation of micro trauma that actually causes inflammatory conditions like carpal tunnel syndrome. Somebody who's got a neck issue because they've been allowing their posture to get into this position for so long. Now we have chronic inflammatory processes going on the discs and joints in the neck. So that's where I come in. Knee injuries, you've heard the term arthritis. Everybody's afraid of getting visited by Arthur at some point in their life. That's arthritis. Well, guess what? Research is now showing that just because you have an x-ray or an MRI that shows you have a little arthritis in your knee, if there's no active inflammation, your range of motion can be normal, and your pain and movement can be normal. So again, controlling inflammation from the outside in is hugely important.
That's right. And then from the inside out, it's more about that chronic, insidious inflammation. And what I mean by insidious is that we don't necessarily know it's happening until it has gotten so bad that your body starts giving you outward signs of that chronic, like very minor, chronic, slow processing inflammation that causes disease.
Yeah, and the interesting thing is, even though you may not have had an injury or you've really never even been hard on your body, but your knees are hurting, your elbows, your wrists are hurting, a lot of times that's not from a physical ailment that you've just macro traumatized yourself, like I said before, micro traumatized yourself. A lot of it is a manifestation of what's going on inside because of an inflammatory environment, an inflammatory diet, and inflammatory behaviors. So a lot of times with patients that come in, I'll deal with a knee issue that's inflamed. I'll teach them how to mitigate that. But we have to look at the inside too. See if there's a pro-inflammatory diet. See if we can supplement to decrease inflammation naturally with fish oils or curcumin or some other supplements that are available.
And we'll get to that.
Absolutely.
Let's first talk about the difference between acute and chronic.
Okay. So acute and chronic it's pretty self-explanatory, okay? Acute is you just hurt yourself, okay? You just, like me, 4 months ago, you're playing with your kid and you sprain your knee. I sprained my MCL. That's an acute injury. Now, inflammation is important because it's actually how we heal. So a ligament sprain is like a sprain of any other tissue. You take that tissue and you lengthen it, and then you pull it past a point where it can't rebound back. If you take a rubber band and take it to its elastic barrier where it's starting to tension, now you can't pull it any further. If you pull further from that elastic barrier will start to actually hurt the integrity of the elastic fibers that hold that rubber band together, and they'll actually start to tear. The ligaments are the same thing, but it's the collagen fibers that are tearing. So I sprained my MCL on my right knee, and it's taken a good 3 months to heal this thing up, and I'm still fighting it a little bit, but I'm back to playing tennis, thank goodness. But I responded right away with a classic inflammatory response: pain from the actual incident, swelling, and stiffness. So in my world, when I was taught, 30 years ago during undergrad in athletic injuries, rest, ice, compression, elevation, the Harvard doctor who actually prescribed that or invented that back in, I can't even remember, it was the 90s, I believe, maybe even 80s. Back in, I want to say 2014, he pulled that back because what they're showing is if you immobilize an area like a moderate sprain like I had. Now, here's the thing. If you tear something and you need surgery, you got to go get it fixed. Okay, you got to go see an ortho for that. But for something like I had, which is about a grade 2 MCL sprain, and just for your education, if you're a dork like me, a grade 1 is micro tearing, just a little bit of tearing if this is the MCL. Okay, a grade 2 is a little bit more tearing. A grade 3 is you've blown that thing, so you may need to have surgery to reattach it. So you're going to get that swelling initially because that's the body's way of saying, hey, you better immobilize that area before you do more damage. And then extra blood flow comes in and inflammatory constituents start to come in to try to flush out and almost pump out what's going on in there. Now, in the act of immobilizing and icing, it can give you some temporary relief of pain, but really what the research is bearing out is you need a moderation of movement to help bail the boat out. So pain-free range of motion is what we recommend, and it's what I did with myself almost immediately. Took a bunch of fish oils, took a bunch of curcumin, made sure my diet was really good, hydration was really good. The one thing I did not do is I didn't take ibuprofen because it can help you temporarily, but you can get a rebound effect. So you lower that inflammation, which you need for healing, but then your body goes, hold on a second, there's no more inflammation. The ibuprofen wears off, and then your body thrusts and shunts a whole bunch of extra inflammation into that area. Now you have like an uptick in pain and an uptick in swelling. So that's your acute inflammation. It's something that just happened. A mosquito bite is acute, right? It's acute inflammation.
Typically, we are aware of it because there's an outward sign.
100%, right. A mosquito bite. When a mosquito gets you, it injects its little proboscis, I think is what it's called, and it injects some of its saliva, which breaks down the capillaries so it can pull the blood out. Well, your body responds to that little bit of saliva as a foreign invader, and the mast cells release histamines, and that makes the area red and swollen. So you scratch it, that's an acute inflammatory response. So when you hurt your knee, that's kind of what it looks like on the inside of your body. Now, chronic inflammation from a micro trauma point, which is what I talked about, is basically something that gets insulted, but on a minor level, okay? So we talk about repetition frequency, lack of rest, and then how much amplitude, okay? And what research shows is the least amount of amplitude, which is range of motion out of a joint. So typing is one of the highest loads you can put on a tendon because it has a high amount of repetition, it has a low amount of rest, and it has a low amount of amplitude. So it's just tension, 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 tension. So basically those tissues tighten up. Now you're creating micro trauma, which builds on itself, okay? So you have a little bit of micro trauma, your body goes, hey, there's a problem there. So basically it's gonna start shunting in cells to create inflammation. Now what's gonna happen is you're gonna get a little micro swelling, okay? Which then cues a process called fibroblast activity, where that tries to heal the area. But that, because you're not giving it proper rest and proper movement, that snowballs into more scar tissue, which chokes off the oxygen supply, which guess what? Creates more of an inflammatory cycle, okay?
And would you say that people that ignore that, then over time, it turns into bigger issues?
100%. So there's research that shows if you take, let's say somebody has a tennis elbow that they've not dealt with. Everybody you see that has the strap right here, okay? Chopat strap or one of those little over-the-counter straps, they have tennis elbow. This thing is not going to do anything to fix it. This thing is going to help with symptoms. That's it. If you don't get in and repair the tissue, over time, what is going to happen is you're going to get this low level of inflammation that's going to affect movement. And then you know you're going to move a certain way and go, that hurts. I better not move that way. So now you're going to lose range of motion. And when you lose range of motion, you get weaker. Not just in the tissue, but the joint. A joint in any part of the body needs full range of motion for nutrition for the inside of the joint. Because if you take a joint, the inside of it has a membrane called synovium. And the synovium is this slippery membrane, and it pumps in synovial fluid, which is like motor oil for the joint. And if you don't move that joint through a full range of motion, you can't pump in synovial fluid. Now the joint stiffens. So you can see that chronic inflammation of one outside tissue leading into an inside chronic inflammatory process.
So that kind of ties right into disease as well, in that even acute injuries can lead to chronic disease of, like just think about if somebody gets that and then they don't address it and then they stop moving and then they lose strength. That is just the beginnings of what we're talking about, where people stop moving as much, strengthening. They're not going, maybe they're not playing tennis, and, so they're moving less. Maybe they're not going to the gym because this hurts and they can't really grab weights.
So let's talk about like just an erroneous sequelae from that. Okay, it hurts to pick up your tennis racket because you're exposing this, or it hurts to pick up a weight. Well, now you stop going to the gym. And everyday life, you're not using your elbow, you're using your shoulder more. Well, now you're asking your shoulder to do more work for what the elbow and bicep should have been doing. Then it starts to break down. Oh, and now guess what? I can't lift my shoulder very well because now it's broken down. Well, I'm going to shrug more and use more of my neck musculature to do stuff. Now you get a chronic neck issue. Okay, and then we get to the point where you just stop moving altogether because you feel so crappy. Now you're moving less. Now your cardiorespiratory fitness goes down.
And that's your new normal. And
exactly.
That's kind of what we're seeing is people who are ignoring this systemic inflammation, whether it being acute that turns into chronic, or chronic that they're not aware of. That is what we are seeing. And honestly, it is very well documented that most every disease is due to chronic inflammation of some sort. And so that is really what this protocol is all about, is us letting people know that that is not the progression you want to follow, that we want to identify the things that are causing the inflammation and then what can we do to prevent them.
100%. And the whole thing of, or the whole idea of, well, I'm over X age, I'm just not supposed to move that well anyways. It's a bunch of bullshit. Okay, there's a ton of research that shows people who play tennis live longer. People who move better live longer. And I'll tell you from personal experience, I've been practicing 25 years. And yeah, I've focused a lot of my practice on athletes, but I've also had tons of elderly people. One of my patients back in Kansas just turned 90 years old, and my friend Chad sent me a video of him doing inverted rows, which is basically his feet on a block on his 90th birthday with rings that are attached to a squat rack, and he's inverted at 45 degrees doing ring rows. He doesn't look 90,
right,
but he's been exercising ever since he was in his 60s.
Right.
I've got a patient here who can barely get off the couch because her back and her hips hurt so badly. She's back to walking and doing things with her friend. The interesting thing about her was she was in so much pain, it was affecting her psychologically because she was too afraid to get out and do things because she didn't want to be trapped somewhere where she couldn't move and get out of that situation. So she stopped hanging out with her friends, which we know as you get older, you need,
social engagement.
Yeah, ikigai or ishigai? Ikigai, which is ikigai, which is basically Japanese, the Okinawans call it its purpose for the day. If you don't have a purpose for the day, you're done. Okay, that it's over. So again, we have to halt the chronic snowballing. And it's not, I'm too old to, it's, you're not moving well enough. You got to let us teach you to move better. And you can always get better at something. I don't care what your age is.
And I'm not really sure that I would be able to find one person who does not want to continue doing the things that they love doing for as long as possible. Nothing says that we have to age like our parents or grandparents or whatever. We now know that we have everything we need to prevent this inflammation and deal with it.
Yeah.
And so that's what this is all about.
Yeah, we're living in a great time because we've got medicine if medicine is needed, but we have tons of research now on alternative type supplementation like you do in your practice to help people get out of an inflammatory situation and get better. I mean, it's just, there's no better time in human history to live than right now.
And I would say for what I do, it's more of making people aware of what to take away versus adding. That really is the beginning.
Okay, so let's get into your side of it. The underlying chronic inflammatory processes that we see that are causing all of our comorbidities right now. Type 2 diabetes, hypertension, cardiovascular disease, all of that. Talk about what's happening from a dietary standpoint that's ramping up that inflammatory response that is causing all these situations.
Well, let's just even talk about cardiovascular disease. We know that processed fats, right? High fructose corn syrup.
Tell me, what do you mean by processed fats?
If you are eating anything on the go, most likely it's a processed fat.
Okay.
So fast food, convenience foods, pretty much anything that you're finding in the middle of your grocery store that is not whole, raw food is processed.
Okay.
Some's processed better than others, but getting rid of those, well, one, let's just talk about, we're kind of jumping into this sooner than I wanted to, but sugar is one of the most inflammatory, that we don't need sugar. Sugar is a like, but we definitely do not need sugar to take care of our health. It has no role whatsoever in sustaining life. Okay, so sugar is number one. Correlates right into that is high fructose corn syrup, which is known to be like shards of glass in your vessels. There's your injury to those vessels that then leads to that heart disease. So we talk about chronic inflammation caused by the things that we are putting in our body, whether it be the products that you're using to clean your home, the products that you're putting on your body, whether it be shampoos, facial products, all of that, as well as the foods that you are buying at the store, our environment, there's a lot of environmental stressors out there. All of this is causing inflammation. Now, our liver really should be helping us break those down. But unfortunately, it's just so much. We were never really meant to eat this way. we were never really meant to evolve this way, where we have our body is subject to so many of these toxic chemicals that your liver can't catch up. And so now we are starting to see more diseases of the liver much sooner, like even in kids now, because our livers are not keeping up with the amount of detoxification that it needs to do.
So like what kind of diseases? What are we talking about?
Okay, so let's just start with like chronic inflammation is known with cardiovascular disease is probably primary. But we all know that most people die from cardiovascular disease, whether it be women or men.
Okay, so cardiovascular disease covering heart attacks, strokes, emboli, thrombosis, that sort of thing, deep vein thrombosis that embolizes to the brain and causes a stroke.
Right. And the problem is the inflammatory response that is caused by your body responding to whatever that foreign body is that is entered, whether it be through your mouth, whether you're breathing it, whether you're placing it on your skin, whatever that be, your body is reacting much like you talked about the injury. And it's like, oh gosh, I don't really know what that is. So I'm going to send something to address this foreign body that comes in the form of inflammation. That inflammation over a period of time is what's causing the disease. So uncontrolled in cardiovascular disease are heart attacks, right? Vessels get atherosclerotic and then we, have a heart attack. We have insulin resistance. So let's just talk about obesity in general. That adipose tissue in itself releases inflammatory cytokines that, chronically release inflammation in our system, or chronic inflammation is happening as a result of that. And insulin resistant comes as a result of that. That turns into issues with diabetes. I mean, it's just, it's a...
Give a 35,000 foot view of insulin resistance, just really quick.
Insulin resistance is, so for every molecule of anything you put in your mouth, your body turns it into sugar. Okay? That's the way it was meant to be. And we can't have sugar in our blood. So our pancreas secretes insulin, and insulin is kind of the guy that goes and grabs the sugar and takes it and puts it into the cell so that it can do what it's supposed to do. Okay. So we need glucose in the cell. We do not need glucose in the blood. Glucose is the result of anything you put in your mouth. Okay. Your body will break it down to that.
Now, if you're resistant and you can't get that insulin out, and now you've got that glucose floating around in the blood instead of going into the cell, what happens?
First and foremost, let's talk about why are you becoming resistant to that insulin. That process is meant to happen, and it's supposed to be very efficient. One doesn't really work without the other. You can't have glucose without insulin, and you can't have insulin without glucose. It's just not the way we were built. But what happens is it's this chronic spike of overuse of insulin. All of a sudden the cells are like, I'm really used to this, and I'm not responding like I used to. The receptors on the cell become more latent, become lazy, and don't accept the insulin like they used to. Well, that causes a whole host of issues because, remember, we can't have glucose without insulin. And so if the cell is not responding to the insulin, that is where diabetes comes from. And we have, that's kind of it in a nutshell.
Gotcha. Good explanation.
Kind of.
Okay, so chronic inflammation, we know from the environment, we know from food, we know from products. It's actually funny, we've been eating organic and trying to clean our house with stuff that isn't super toxic, natural soaps and that sort of thing. But, if you recall a couple months ago, well, of course you recall, you're the one who did it, but I went to grab my tube of toothpaste and I was like, what's this? And you're like, well, it's a new type of toothpaste that doesn't have fluoride in it. And the interesting thing was I knew about the microbiome of the mouth, and I knew that. So for those of you who don't know microbiome is the essential good healthy bacteria that we have in our mouth, our nose, our intestines, everywhere, even on your hands.
Yeah.
head to toes, and that's what regulates immune function and so many other things. But anyways, I knew mouthwash you didn't want to use because it kills 99.9% of bacteria and viruses, but guess what? It kills all the good stuff in your mouth too. And what you were saying about this new toothpaste, obviously no fluoride, because fluoride apparently is not safe at any level because it's a neurotoxin. But after you brush your teeth, you said those little, people described it as, I feel like I got sweaters on my teeth, where you kind of run your tongue along your teeth and you feel like it's rough, where people like it nice and clean. Well, that roughness is actually super healthy for your gums and your teeth and your mouth, because that's part of the microbiome. Now, it doesn't mean your mouth is gross and we have bad breath.
Well, no, let me clarify. The bacteria in your mouth, which is, you need that good bacteria in your mouth. I think we associate bacteria with bad.
Yeah.
And I think as people learn more and more about the microbiome, they're going to realize that the majority of the bacteria head to toe is good. However, we can have an overgrowth of the bad, and that's where issues come. But the sweaters on your teeth are what the bacteria feed off of to stay healthy. So, for instance, recently when I went to the dentist, since we switched over to that toothpaste, he was like, my hygienist was male, and he said, wow, like there's nothing to scrape off your teeth. You have no tartar, you have nothing. And that is not how it used to be when I used fluoride toothpaste. They used to, have to get at some tartar. It's because the bacteria in my mouth is eating along my gums all that stuff and staying healthy so that there's not a buildup of tartar.
Yeah.
So that's a good thing.
Do you remember the xylitol gum you were chewing and how
it brushes your teeth?
It brushes your teeth. Yeah. So we were years ago when we were driving somewhere, we were listening to a Joe Rogan podcast with Rhonda Patrick, and she mentioned having cavities while she was pregnant, and she had to wait till she was, postpartum to get the cavities filled, but she was chewing xylitol-based gum and it healed the cavities. Yeah. And I remember that was back in like 2017 or 18. I remember you saying, oh yeah, I've known about that for a couple of years, not to take anything from her, but kudos to you. But yeah, so it must do something. The xylitol must feed the microbiome in the mouth in some capacity, because cavities are an overgrowth of bacteria, I believe, creating a cavity in the tooth, right?
That sits there.
Yeah.
I think it's when it's allowed to sit there. But if you have a healthy microbiome in your mouth, they're not going to allow for cavities because they're eating it.
Right. Yeah.
So
pretty cool.
Yeah.
So this is
we digress.
This is Joan's dinner conversation.
That's right. We digress.
Okay. So let me go back to the cardiovascular disease, because I want to hit on something. So everybody out there has probably been checked. Everybody out there who's over 40 has been checked and told, you don't want high cholesterol. High cholesterol equals bad. Well, in some cases, yes. In some cases, no. Again, I'm not your doctor, so discuss this with your doctor. But what you need to understand is there's a whole body of research that shows all of the statins that have been prescribed for 30 years now, what they think the statins were doing to save lives from hypercholesterolemia, which is heightened cholesterol, is decrease the inflammatory response around said cholesterol. We need cholesterol for hormone function. We need it for brain function. We need it to build cellular walls. Cholesterol is just basically like fat, and we need that for the lipid bilayer of a cell wall, okay? But the thing with cholesterol is if you lower it too much, you diminish its capacity to do what it needs to do in the body. We actually generate it through the liver. So the interesting thing is you can have high levels of cholesterol but have no inflammation, and you're at zero risk. The plaques that form in the artery that will block the heart, or one of the vessels in the heart that actually cause a myocardial infarction or a heart attack, are basically clumps of cholesterol that are inflamed, that calcify and harden, then the blood can't get through, and now you have your heart attack because it can't feed that, the blood coming from the vessel can't feed that area of heart muscle or myocardium. So you can have some cholesterol stacked in your vessels, but if it's not hard and inflamed and calcified, it's no problem.
And the other thing too is a lot of the times those plaques don't adhere unless the vessel is damaged.
You taught me years ago sticky.
Yes.
If your vessels are sticky from inflammation, so if you've got that mosquito bite and you've been scratching it and it kind of, sometimes it'll even ooze a little bit, think of that as the inside of your vessels. That's getting sticky. And that's what we don't want stuff sticking to.
And that's where you stop and say, what am I putting in my body? What am I, because those vessels, by the way, cover your entire body. And if you don't have blood supply, guess what happens to said organ? If you create a lack of blood supply, you are going to have issues. So it's important to say it's not only a cholesterol issue, but it's not like it has to be a bad, sticky cholesterol, but it also, that the vessels typically are damaged.
Yeah. So again, chronic hidden inflammatory processes that have been going on for years and years that you don't know about. When we were growing up in the 70s, you never heard about somebody who's celiac or somebody with a peanut allergy or somebody with lupus or rheumatoid arthritis. I learned about all this stuff in school in the early 90s, and
it was hard to find patients.
It was hard to find patients. Now, it seems like 1 in 20 patients are coming in saying, oh yeah, I've got this, or I've got that, or I've got lupus, or I have fibromyalgia, which, if you ask me, fibromyalgia is a cop-out diagnosis. That's a doctor who's being lazy about the symptoms that their patient has and wants to just give them a med and get them out of the office. If you have fibromyalgia, it's because your body is telling you something that it doesn't like you're doing. You have an inflammatory process going on inside your body you need to deal with. So that leads us into the autoimmune diseases, right? Lupus, ankylosing spondylitis, rheumatoid arthritis, fibromyalgia, chronic fatigue syndrome. I mean, these are all chronic inflammatory situations. And I know from what you've told me clinically, restless leg syndrome. All of these things that people are getting meds for, you teach them how to supplement properly with proper minerals, vitamins, and nutrition, symptoms clear up.
And I think that's really the point to point out right now, is that most all of this is preventative. Your body is really smart, and it's trying to let you know things are not right. The sad thing about chronic insidious inflammation is that we don't always know until something is really wrong. And let's think of, the GI tract, where you've got, Crohn's and ulcerative colitis, which are a result of inflammatory response in the gut lining. You don't really know that's happening. Your body's not really giving you signs. Now, if you're celiac like I am, obviously you're responding to foods that have gluten. However, ulcerative colitis is the breakdown of the lining where you have ulcerations. Eventually you'll get signs of that, but at that point the disease is there. So that's the scary thing about the chronic inflammation, is a lot of the times we don't have signs until the disease is there. If you live, however, a lifestyle that prevents it from the very beginning, most likely you can prevent that from ever happening. And I really wish I would have known about this type of lifestyle back when I was growing up, and I would have done things much differently. And I think the outcomes would have been different for me being celiac.
Yeah, but we're all a product of what our parents fed us. It's not like if you were 8, you're going to go, Mom, I'm not eating that processed slice of cheese. It has XYZ in it. She's going to say, shut up and eat what's in front of you, or go to bed hungry.
We really are kids. I would say it's my grandparents were really the ones that started with all of the processed foods, the Miracle Whips, the Velveeta cheeses, all of that stuff that wasn't really food. And then our parents' generation just continued that. Our generation is kind of like, oh, wow, there's a lot of bad that's coming from this. So now it's like this awareness of, I don't really think that's the way we want to age. And that's really what this is all about, is prevention. Most all of these chronic inflammatory diseases can be prevented with a good lifestyle. That's what our Get Better Not Older protocol is all about.
So let's play devil's advocate here. Okay, I'm in my 50s and I already have one of these situations. Okay, I already have ulcerative colitis because I've been eating like crap for 30 years. Am I screwed?
No. I think what I start with, which makes the biggest difference up front, is removing the things first that are causing the damage. I mean, you can throw a supplement at something. However, if you don't remove what's causing the damage first, you're going to have a hard time healing whatever it is.
So that's a huge mountain to move. So what are your first steps to,
Well,
like, how do you figure out if a patient comes to you and says, I've been diagnosed with ulcerative colitis, and normal treatment is to go on prednisone, which is a really heavy steroid, have their colon scoped to make sure the ulcerations aren't bleeding or whatever, which you told me, I didn't know this, but after you have a colonoscopy, it completely clears out your microbiome, right? So where do you start? I mean, that's a huge mountain to move.
Yeah, and that's probably a whole nother podcast that we could go through, healing the gut. But honestly, it's removal of those things that are causing the damage. So
what's the low-hanging fruit on that?
The low-hanging fruit is ultra-processed foods.
Okay. So get rid of anything that has more than one ingredient. Let's start there. Broccoli doesn't have anything more than broccoli in it, right?
Right. Chicken is chicken, right? So you're everything that has a ingredient list this long. I go through all of this in detail in the protocol. It is so important to think and stop and think, what are you putting in your body? Like, is your body deriving any nutrition from that? If it's not, most likely it is damaging you. I mean, there's really no way around that. You're either feeding disease or preventing disease. That's just kind of the way it works. So stop and think about what you're putting in your body. So I would get rid of ultra-processed foods to begin with. I would get rid of processed saturated fats. So those are fats that are solid at room temperature.
Okay, so sunflower oils, canola oil, name some other bad oils.
So that's not saturated fat. Those are omega-6 oils. And yes, you want to have more omega-3 fatty acids versus omega-6. A lot of everything, you could pick up any label, and I guarantee you're going to find one of the omega-6 oils. You just listed them. Sunflower, safflower, canola is half and half. Some monounsaturated, some poly. It's
palm oil.
Corn oil. All of those you want to lessen. Switch those out with healthier fats, which are your monounsaturated fats, which are predominantly your olive oils and your avocado oils.
And then like a beef tallow, if somebody's not like me and has a polymorphism, and you can do saturated fat.
That's right. And I mean, I think it's important to know, can your body break down that saturated fat? But it is one of the fats that you do need to limit. It's not a free-for-all. I mean, it is known, to cause issues if you have an abundance of it. It's all, again, about moderation, truly, and just knowing that really you're much better off with a beef tallow, like saturated fat from an actual animal that wasn't processed versus these hydrogenated fats. And the process of hydrogenation is taking a fat that is naturally solid at room temperature, which is your beef tallow, and unsaturating it in a test tube to make it less saturated,
to make it liquidy,
to make it more liquid, which are your margarines or your whatever, and those aren't necessarily better. As a matter of fact, we know they're not better. Back when everybody was having heart attacks and we would do autopsies, we would find a lot of these trans hydrogenated fats in the vessels. So they're just as bad as our saturated fats. So it's hydrogenated fats. It's processed anything. It's sugar, okay?
Sugar's the main thing. Sugar's the devil.
It's our standard American diet, right? Refined carbs, right? That's everything we eat is refined carbs, sugar, processed. I mean, it's not just one thing that we take chicken, but we have to deep fat fry it in the worst oil possible with breading around it, that type of thing. Get back to the way your ancestors ate. And it doesn't have to be boring, by the way. There are a lot of great products that we have that can make this super easy, which I actually have an entire video of in the grocery store, some staples to have that make it very easy to put together whole meals that are not processed very easily.
100%. Yeah. I mean, dinner time It's always good. I never bite into anything we're having going, oh, can't wait to eat this leather again. I mean, it's good. You just have to learn the processes, and that's a challenge. But honestly, if you just start with healthy meat, some fruits and vegetables, it's kind of a good place to start.
Right.
If the earth grows it, it's probably going to be fine for you.
And that, let me tell you, like, we know this, that the earth grows in perfection, what we need to take care of our body. It was really meant that way. However, now we're spraying everything. And guess what? Those chemicals are now causing issues of systemic inflammation and causing disease. We're genetically modifying things. And, even though corn was meant to be this way from our ancestors, we're now genetically modifying it so it can grow faster and it doesn't go bad, and beetles can't eat it, and blah, blah, blah. And you have to understand that our physiology was not meant to accept that. And there is going to be issues from that long term.
Yeah, 100%. So we're moving on from our autoimmune diseases, like we talked about, rheumatoid arthritis, lupus, ankylosing spondylitis, celiac disease, all the aforementioned. Then we have our chronic inflammatory diseases that are basically like your asthmas, your COPDs, your irritable bowel. That's another one. Like, so when you were getting diagnosed when we went through all that rigmarole getting you diagnosed with celiac, and the doctors kept saying, oh, you just have IBS, you have a sensitive tummy, you have irritable bowel, take this med. Again, not trying to knock the medical profession because you don't know what you don't know, but what a freaking cop-out. That's like somebody coming to me with a bad shoulder, and me going, oh, just don't move that shoulder, you'll be fine. Yeah. Just don't move it. You got another one, use that left one. It's like IBS. If somebody tells you you have IBS, you need to find somebody who knows what they're doing, because IBS is a symptom. It's not a diagnosis.
Right. And there are a host of labs that can be done that you and I order for patients all the time that actually, is it what we call dysbiosis that's causing your IBS? Dysbiosis is a disruption in your microbiome where the bad guys have taken over a little bit too much.
Yep.
So, sometimes it can be as simple as correcting your microbiome and then you're fine. But you're right. IBS is just one of those generic diagnoses, basically saying we don't really know why you're having these symptoms.
Yeah, it's pretty sad, honestly.
Yeah.
And then moving on to something that I find incredibly interesting is Alzheimer's. They're now calling it type 3 diabetes because the British doctor that falsified and really set people with Alzheimer's back 15 years, for those of you who don't know, he falsified data showing that amyloid plaques were the problem in people with Alzheimer's when they found their brains, or when they did biopsies on the brains after they succumbed to the disease. Well, it's a bunch of crap. It's not amyloid plaques. They're calling it type 3 diabetes because you have insulin resistance, where you have two things that will cross the blood-brain barrier. The blood-brain barrier is the little small vessels, the capillaries, that feed nutrition into the brain. The brain can function off glucose and it can function off ketones. Well, when you have insulin resistance, and like you said before, the glucose in the blood cell in the brain can't get to the brain tissues, well, guess what's going to happen? Yeah. The tissues are going to become damaged. The neurons are going to shrink. The neurons are not going to fire right. Now, all of a sudden, you've got memory issues. You've got movement issues. So, again, there's people doing great, and I'm not a specialist on this, so I can't talk super highly about it. I can only just mention it, but you clean up the inflammatory process, you get your insulin in check, your brain is even going to be healthier.
And that, there clearly is a genetic mutation that gives you that predisposition. But they are now even finding that which is the same with obesity and everything else. Yeah. You can have that genetic predisposition. However, that does not mean that is the end result if you take care of yourself.
Yeah, it's called epigenetics. Okay, when somebody says, "Oh, my genes, my whole family was fat," well, okay, maybe you have a predisposition to it, but your epigenetics, which are the little things at the end, the telomeres, you can actually change those by behavior and change the way the gene expresses itself. So you can turn a obese affecting gene. Again, I'm not a specialist in this, so excuse me if this sounds a little rudimentary, but you can't take a gene that's going to express as obesity and just completely switch it off, but you can change it a little bit to change the direction of how your body's going to react and your set point's going to be, so you can actually be a little bit healthier from a body composition standpoint.
Right. We could do a whole
Maybe we should.
podcast on that. Yeah.
Maybe we should.
And we kind of are doing high level here, just kind of, to mention every single thing, honestly, about our protocol is about preventing inflammation, whether it be acute that turns into chronic or it's preventing disease. Like everything we have written in this protocol is all about removing and reversing systemic inflammation.
100%.
Yeah.
So we could pretty much spend literally hours talking about all the things that inflammatory issues cause, but we've covered a lot. So let me just mention one last thing, and you mention this all the time. It's skin disorders. It's really funny. Anytime you see people with lesions on their skin, or you see somebody scratching, or you see somebody with bad acne or psoriasis, exactly. It's usually an expression of something from the inside, ramping up inflammatory, manifesting as something outside.
And I want to bring something up because this bothers me. I see so many people spending money on products and procedures to change the way their skin looks. When, if you want to prevent wrinkles and you want to prevent the signs of aging, you got to treat your cells properly. So everything that we're talking about, I mean, we're not even talking about disease here. We're just talking about signs of aging. The first thing you should be doing is worrying about what you're putting in your mouth. If you want to change wrinkles, that's the first place we should start. A lot of people are spending a lot of money on creams. That's just topical. It's not going to change your skin at a cellular level, which is really what you need.
Right. Okay, so devil's advocate. What's the first thing I should be doing if I don't like the turgor of my skin, or if it's wrinkling and getting kind of flaky and I'm bruising easily?
Just nourish. I mean, your body needs nourishment. Your skin needs nourishment. So we're talking fruits and vegetables, right? And why? Because the free radicals that are caused from inflammation are circulating in our blood. Okay. So if you walk outside and a car drives by, you have just breathed in some carbon monoxide, correct? Or you're standing on a busy corner, same thing. Okay. So that enters your system and as free radicals, right? And so those are bad guys. And the first thing your body wants to do is that's oxidizing your cells. We don't want oxidized cells. It kind of sounds like it could be good, but actually oxidation is not great.
So to give you an example, when you take a bite of an apple and you leave it out and it turns brown, that's the oxidization.
And that's what's happening to your skin, truly. Like if you are not reversing the damage from the free radicals that are being caused by the way you eat, or that you're breathing in, or that you're putting on your skin, or the chemicals that you're cleaning with. Everybody has heard of fruits and vegetables being a great source of antioxidants. Well, let's just talk about that word, antioxidants. So it is actually reversing that oxidation at a cellular level. That's what we need to be focusing on. A lot of people say, oh, I don't like fruits and vegetables, or I don't like that. Well, if you're spending money and time because you're worried about the way you look, the first thing you want to look at is starting with those antioxidants, because those are going to be what protects every single cell in your body.
Okay, so what about collagen supplementation? Because most people don't sit there and gnaw at the bones and the cartilage, right?
That's right. If we were hanging out in the cave, we would be gnawing on what we killed down to the bone, right? And sucking all that in. Collagen supplementation is great. I put mine in my coffee. Transparent Labs has a great one that we use. And
code Dr. Rob to get 10% off on that. Really
that's
good.
Right.
I put it in my tea every morning.
As a matter of fact, I had a friend text me this morning who said her nails have never looked better since switching over to the Transparent Lab. So that's good.
There you go.
But anyway, so as we age, yes, your skin starts to break down because we do lose collagen. There's really that's just aging in itself. You can, however, one, If you do get a nice rotisserie chicken or you make a chicken, gnaw on the bones, chew on the cartilage. I know that grosses you out, but your dad loves to do that. Like, I don't mind doing it. That's a great way to do it. Or you can supplement with collagen. I like to put mine in my coffee in the morning. Just check it off the box.
And again, the amount of stuff, especially young girls, are putting on their face makeup-wise. I mean, you've got pores. Underneath those pores in your skin, you have capillaries, these little tiny vessels. They will absorb stuff and pull it into your system. So you've got to be hyper aware of what you're putting on your face.
Yesterday, I went shopping with our daughter, and we have an app that we scan the product and it rates it. And every single thing that I saw this on TikTok, scanned it, red, bad.
Yeah. What was the app?
It's called Yuka.
Why?
Yuka. Really like it. So you just scan the barcode and it gives it a grade as far as what's in it.
Nice.
And then it even gives recommendations on a different product that you could switch to.
That's very cool.
Yeah.
Isn't it sad we have to have an app so that works for food as well, that Yuka?
Yeah.
Horrible that we have to do that, but it's awesome.
It's a what we call our little hacks that we like to do.
For sure.
So the other thing, in addition to, we talk about what we remove, but in addition, we need to talk about what to add. Omega-3 fatty acids. If you don't feel like you eat a lot of fatty fish, then I would supplement with an omega-3, a good omega-3 fatty acid.
Yep. Don't get the cheap stuff from Walmart. Get a good brand like Transparent Labs. I also like to use Ultimate Omega from Nordic Naturals. It's very cleanly sourced. Look at the EPA and DHA. Don't just look at the total fish oils. You want to get a supplement that has, in about 2 or 3 capsules, minimum 1,000 milligrams of EPA and DHA combined. I take some about 210 pounds. I take 4 to 6 capsules a day, which is going to put me into the kind of 2,500 to 3 grams a day of fish oil. But again, depending on your size, you need to do that. But great for cardiovascular health, great anti-inflammatory.
Absolutely. And then olive oil, I would say. You do have to be aware of the smoke point of olive oil because it has a very low smoke point, meaning it's really meant for more cold than hot cooking, super hot cooking. So then I would switch to something like an avocado oil in that situation that is a good fat that is stable at higher temperatures. Turmeric is known, across the board to be a great spice that you can use that can help decrease inflammation. If you don't cook with turmeric, then you can supplement with that. So those are just a few. I mean, we could go on: dark chocolate, green tea, bone broth, avocados, peppers, broccoli. All of those are known to be anti-inflammatory. I go through all of this in the protocol. We really talk a lot about the importance of eating in a way that's a major prevention of oxidative stress in your body, which is the damage, the disease. I mean, truly, that is where the disease is coming from. It is that oxidation that's happening at that particular organ constantly that is causing the disease, and we can prevent that with what we don't put in our body and with what we do put in our body.
So again, great way to wrap that up there. Follow Shannon's protocols for what not to put in your body and what to put in your body. You follow my protocols for how you move your body, taking away certain movements that we know are really not great for you, potentially injurious. I call those backbreakers. And then creating movement where movement should be had, and creating stability where stability should be had, and then building strength on top of that, so we're not building strength on top of dysfunction.
And that makes me think we haven't really mentioned exercise. And I know we've talked about it in previous podcasts, but it's that ability to reverse that inflammatory response with exercise. Do you want to explain how that happens?
Well, 100%. So again, going for a walk, which is your zone 2 cardio, where your heart rate is elevated enough, but you can still carry on a conversation. You're not huffing and puffing. You're going to get better circulatory metabolism. You're going to get better exchange of glucose with better ability of the insulin to no longer be, or the cells no longer being resistant to that insulin being uptake with the glucose into the cell. Working on VO2 max, which is more of a higher type of intensity training. And there's research that shows you can increase your VO2 max with only 3 to 4 minutes of really hard work, resting and doing a couple of sets of that. The better your cardiovascular system functions, the better you can clear the bad stuff. It's just like, think about it, just like a filter in your pool. If your filter is stagnated, you can't get that yucky stuff out of your pool. If your cardiovascular system is really fit, you can process that bad stuff out quicker, and you can basically increase the oxygen and all the nutrients at a more readily available rate. Now, when it comes to strength, that's going to build resilience against the acute injuries. The stronger you are, the less fall risk you're going to have, the less potential you're going to have for strain. And if you're doing mobility and stability drills, or I shouldn't even really say drills, we're more frequent exercises throughout the day, you're going to mitigate the micro trauma. So we talked about. So I know it sounds like a lot, but it's really not. Follow the plan. We've got it laid out for you. It's not as hard as you think.
Yeah. Well, I think we should wrap up. Do we have some questions from our followers?
Yeah, let's check. Yeah, I always love to answer some questions.
Okay.
All right, so a couple questions from the audience. So this one is for Rob. What are the first steps or things that I can do that are quick and easy, because exercise is really intimidating and new to me? Easy question. I would love for you to start lifting weights a couple days a week, but if you're intimidated by it, start going for a walk. Just get more steps in frequently throughout the day, and then after dinner, go for a 20-minute walk. But park further away at the grocery store. Park further away from your building when you go to work. If the photocopier is on the 3rd floor and you're on the 1st floor, take the stairs. Don't take the elevator. Move more. Set alarms throughout the day. If you've been sitting for more than an hour, get up and move around for 60 seconds. So I always say, try to do things like the 20-20 rule or the 60-60 rule. 20-20 is every 20 minutes, move around for 20 seconds, stretch, walk around the office for 20 seconds, then get back to work. 60 minutes, same thing, 60 seconds. If it's every couple of hours and it's lunchtime, eat your sandwich or whatever and go for a little walk. You don't have to get your heart rate up and get all sweaty, but just move more. Try to get north of that 10,000 steps a day. Okay, good question. Okay, now this is for Shannon. At the grocery store, what is the first thing I should change? The first thing. I mean, that's a lot, but most impactful thing, I think, is what they're asking.
And I do have a whole video on this in the protocol, but in a nutshell, you should stay on the periphery of the store. I would say that if your cart is full with one ingredient foods, then you have made some pretty major changes in your health. That would be first.
Fruits and vegetables, steak, chicken, eggs, healthy organic dairy.
Yeah.
That's all one ingredient.
And it's typically on the periphery of the store. Try to stay out of the boxed, all of that stuff.
Yep.
So that would be where I would start.
Okay, both of you. Rob, favorite exercise. Shannon, favorite food hack. Go, favorite food hack.
I would say my favorite food hack is a rotisserie chicken. I feel like if everybody would get a rotisserie chicken every single week, it can make several easy meals. Mm-hmm. So that's mine.
Yeah, we usually do that on Sunday night, and then we eat the chicken in some format Sunday night, and then we'll make chicken salad I'll take to the office the next day. It's pretty simple.
Some people will get two, depending on how big your family is, just so that it can last. If you look at your calendar and you've got some busy evenings coming up and it's not going to have a lot of prep time, that rotisserie chicken can be the difference in not going through the drive-through at a fast food restaurant versus, having something healthy.
100%. And for me, my favorite exercise, that's a tough one because there are so many good ones. But honestly, I would have to say the squat because it has the most practical application. It even works your core. So if you don't know how to do it, go to my Instagram. I've got plenty of posts on that, but the squat is your best bet because it works your legs, it works your core, it works your upper bodies. your upper body. It teaches your feet to contact the ground, and it burns a ton of calories and will help your nervous system get strong pretty quick. So there you go. That's the end of episode 5. So thank you so much for tuning in. And remember, I'm Dr. Rob Jones. I help you get better, not older, from the outside in.
And I help you get better, not older, from the inside out.
Thank you so much. We'll see you next time.